Anjali, why do we age?
In women, the menopause plays a very important role. So we have a loss of estrogen, and that kind of reduces the protective effect of estrogen. Estrogen is normally, it plumps up the collagen and keeps the skin looking younger, and that's what causes the aging.
But is male boobs a common phenomenon normally?
It's off late, it is becoming common.
Is it a
Whether
lifestyle?
It is lifestyle. I think it is because of lifestyle. The kind of fast food that this generation is addicted to, lack of exercise. Because when we were growing, we would be running most of the time, and now it's more of sedentary, and can't even blame them because there's so much of pressure on them.
That's true. What is Ozempic, and how does it help the body to lose, and what is the disaster that happens in Ozempic?
So Ozempic is basically semaglutide. Okay, it started as an anti-diabetic drug, but they noticed that the side effect of that is weight loss. It basically increases the satiety, so the person feels full even after having a very small meal. Automatically there is weight loss, but a major side effect of this is
Hi. Today I got the pulse, my finger on the pulse. The whole internet is viral with information on cosmetic surgery, plastic surgery, looking younger, looking better, feeling better. If you are also looking for such a story, then you're in the right room. Hello, I am Meenamma. I'm a storyteller and a trainer, and I wish to share my chats with inspirational people around me on varied topics of global interest, with the hope that my audience may design a better life for my episodes. Each talk is an inward journey. Come travel with me today to meet an extraordinary woman, a superb human being. But do watch this episode till the end and subscribe to my channel, Meet Meenamma, on YouTube, Instagram, and other handles. I will be putting out short clips and exciting reels on this episode for you to get valuable insights in lesser time. I need your help. I need your help to grow. Do hit the subscribe button right away. Thank you in advance. Meenamma today is proud to have with her in the studio Dr. Anjali Saple, who's an MS in general surgery, a DNB in plastic surgery, with a fellowship in cosmetic surgery from the Mercy Hospitals, Buffalo, New York, and another fellowship in cosmetic surgery from Rio de Janeiro, Brazil. She's a consultant plastic, reconstructive, and aesthetic plastic surgeon at the Seven Hills Hospital, Visakhapatnam, from 2001. In fact, it was Anjali who started the Department of Plastic and Cosmetic Surgery in the Seven Hills Hospital, which caters to patients from Andhra Pradesh, Chhattisgarh, and Odisha. At that time, she was maybe the first lady plastic surgeon in the city of Visakhapatnam, south in this area, the coastal Andhra Pradesh, and it was she who started microsurgery in the Seven Hills Hospital. She also set up a dedicated intensive care unit for burns. She is also the project director of Smile Train, under the aegis of which she continues to provide service to children with cleft lip and palate. She believes in constantly upgrading her skills and her knowledge so that she can provide the best of care to her patients. Anjali has several published papers in the field and has memberships in the APSI, the Association of Plastic Surgeons of India, the IIPS, the Indian Association of Aesthetic Plastic Surgeons, and the ISAPS, the International Society of Plastic Surgeons. Adding to her credentials is that she is a YCB, a Yoga Certification Board member, level 1 and 2 and 3 by Ayush, and a yoga instructor course YIC. She's also from the Dean University and a student of Bharatnatyam. Her core interests lie in aesthetic breast surgery, body contouring and facial cosmetic surgery. Without much ado, let me welcome Dr. Anjali Saple to the Meenamma show and share with us and her experiences as a senior plastic surgeon to highlight her experiences in the niche field of surgery. Hi Anju, how are you and how does it feel to be with Meenamma today?
Oh, it's really very nice. I mean it's been awesome actually knowing you as a friend and guide, and being here with you is an amazing feeling, I must say.
Thank you, Anjali.
Thank you so much for having me here, and thank you for that introduction.
Anjali, our relationship goes back many, many years.
True.
But the first time I really saw you as a professional was a time when one of my colleagues had a bad accident during one of our events, and his eye got smashed.
Yes.
And we thought he had lost his eyesight and his eye was looking like a black hole. But within hours, I brought him to you because someone referred you and I didn't even know you, saying that she's excellent. And what you did with that boy is commendable, because if you look at him today, he might not have good eyesight, but you cannot make out that that black hole that existed that day actually was a hole beyond repair. You have stitched him up so beautifully, and he's as handsome as ever. And I'm grateful that I chose to bring him to you, and our paths crossed that day. Anjali, more than $2,000 million have been spent on cosmetic surgery, plastic surgery in the last few months in the world. Okay, and I understand that plastic surgery, cosmetology is a 5,000-year-old field, started in India by Susruta many years ago. Yes. You are right there at the right place at the right time. You are actually one of the pioneers of plastic surgery, reconstruction, and of course, cosmetic surgery. So today I'm going to ask you more questions on this. Okay. Can you tell us about your journey into plastic and cosmetic surgery and what motivated you to take this specialization?
So, Meenakshi, actually, when I was doing my medical education, I did it from Lokmanya Tilak Medical Hospital in Mumbai, and I was doing my surgery. At that point in time, we had allied postings. So there I was, I thought I would take up plastic surgery and as an allied posting just to see what is in the field
what
of
is
plastic
allied
surgery.
posting?
It's like when you're doing general surgery, there are multiple allied branches that you can work in.
Okay.
So I decided to work in plastic surgery just, out of interest. And I must say, I saw, I think, 2 cases there which totally changed my perception of plastic surgery, because I always thought plastic surgery is that glamorous field.
Yes.
So the first case was where, a worker, his hand had got chopped off completely in a machine. And they brought that hand, and with a lot of hopes and aspirations that it would be joined to the body. The plastic surgeon who was on duty, I saw him meticulously stitching up each and every part that is there in the hand, the tendons, the muscles, the nerves, the blood vessels, the bones. And after a few weeks, I saw that dead hand come to life.
Oh my God.
So this was something that totally changed my perception. And the second case that I saw, that was again a diametrically opposite case, where there was this lady who had delivered triplets, probably a year back or 2 years back, I'm not really sure, I forget. But she had this huge pendulous abdomen. It was so big because of the triplets that it was interfering in her day-to-day walking, day-to-day chores, so much so that she was unable to take care of her children.
Okay.
She had, severe low backache, knee pain, and she had been going to multiple doctors, like an orthopedic surgeon, a neurosurgeon, a physician. And finally, somebody referred her to the plastic surgeons because they felt that it is this pendulous abdomen which is really the cause of all this
discomfort,
postural issues and discomfort that she's facing. And over a 5 or 6 hour surgery, I saw them actually reconstructing and kind of remodeling the entire pendulous, flabby abdomen. And at the end of the procedure, she had a nice flat
Wow.
abdomen, almost like she had never born kids before. So this transformation, these two diametrically opposite cases made me realize the potential that is there in plastic surgery, how a person can make a change in somebody's life. And I guess somewhere that stuck on, and I just, it was good fortune that I managed to get into this field.
Tell me, what are the typical procedures? What are your typical, what you would normally advocate if you have a patient? What are the typical procedures you follow?
So I presume you're talking about the cosmetic surgical procedures, right? So nowadays we are doing a lot of non-surgical procedures, like you have Botox, you have fillers, you have peels. And surgical wise, we have, like if you start from head to toe, so you have blepharoplasty, you have rhinoplasty, a lot of surgeries for the aging face. There is, chin lift, neck lift, breast augmentations, reductions, gynecomastia or male boobs, liposuctions, abdominoplasties, mommy makeovers. So basically, there are all these procedures that we are doing, and there has been an exponential increase in the number of people who are seeking these procedures.
To look better, to feel better.
To look better, to feel better, yes.
And when a patient comes to you with this kind of thing, what is the expectation they have? They want to look beautiful, feel better, of course. But when you meet a patient, do you always take up the surgery, or there are some people you just deny?
No, there are definitely many patients who I deny, because the reason for undergoing a procedure has to be solid.
Correct.
It cannot be a frivolous reason. So a lot of counseling and a lot of consultation sessions go in before I decide to take up the patient for surgery. Some of them have a lot of body image issues, a lot of psychological issues. So if they are getting a surgery done for that reason, I need to go into the background check that okay, this patient is right for this procedure.
Okay. So there's more of psychological counseling before you start.
Yes.
Because they come with expectations which might be difficult for them later, isn't it?
It might be difficult for me also to live up to those expectations. So I need to understand what is the realistic goal that they're looking at.
See, now there's a make me perfect generation. I mean, it's a term that is coined for many people, whether they want to reverse their age, or they want to look beautiful, or they want to look like somebody else. So, this make me think, what is this new generation about? Have you seen a kind of a change in the last 10 years on people who want to look better for, no reason? Or what is this make me feel better generation?
It is absolutely a huge change. In the last probably 5 to 6 years, especially I'm noticing this post-COVID. So I don't know whether it is, that they want to live this life to the fullest, or it is that, there's a lot of Zoom calls happening, there are a lot of video presentations happening. So everybody wants to look their best. Another issue is that youngsters are now earning. They have money in their pockets. So they want to spend it on their bodies, on their faces. And so what if it entails a surgery? So I think it's there's a huge generational shift. And the number of patients, the age of the patients is reducing, number one. Also, these procedures were earlier usually asked for by people who were, probably well-heeled or the so-called elite.
Correct.
But now it is even the middle class and the lower middle class people who are coming in for these procedures. And why not? I mean, people want to feel good in their own skin. So I think it is really important for us to make these procedures affordable for everybody, so that everybody can avail of these procedures.
Of all the procedures, which is the most common that normally you do?
I would say liposuction.
Liposuction?
Yeah, so it could be for anything. It could be for arms, it could be for chin, double chin, it could be for abdomen. Most common is what I do is for male boobs or gynecomastia. for thighs, buttocks. So I would say predominantly liposuction. Close next would be rhinoplasty.
Okay. You know, I had done a small shot on rhinoplasty. Actually started in India.
Yes.
And it was, it was done by a cobbler.
Yeah,
But
yeah.
today I think India has given to the world and it's
Yes.
become a big deal.
Yes.
Tell us about, there are so many celebs, actresses, singers, musicians who all have done rhinoplasty. And can you make out when somebody has done a facelift or a rhinoplasty or a Botox? Is it very visible? Because some people say you can make out they look plastic.
Yes.
So plastic surgery.
As a plastic surgeon, I think all of us have that innate eye to look at, what is the perfect nose and how, like actually if I'm looking at a celeb, I actually sit and analyze her or his features.
Yeah.
That okay, he would do well with probably a rhinoplasty. He would do well with probably a jawline correction. So yes, a lot of them have undergone, and you can make out. Many of them you cannot. But yeah, I mean, but there are certain procedures which should be done to the. It should not be overdone. Like for example, you have fillers or you have Botox. So if you overdo these procedures, then it gives that mask-like appearance, and that is something that should be avoided.
What is the difference between Botox and fillers?
So Botox is a neurotoxin.
Okay.
Botox is of course the trade name. It's botulinum toxin. So that helps to correct the dynamic lines. So which are caused by wrinkles, which are caused by the muscles of the face. But once these lines become static, then what we need to go in is for fillers. So fillers are basically, compounds which contain hyaluronic acid, which helps to plump up the skin and fill in those fine lines.
Okay.
But whereas if they are dynamic, they are still dynamic, then they can be corrected with Botox, where we kind of temporarily paralyze those muscles so that those lines disappear.
Now tell me, see, there is a world of difference between a plastic surgeon and a trauma surgery.
True.
And I think that is your strength personally. I mean, initially what you started with.
Yes.
Today the market is asking you to get into another field, but you save lives. I've seen you with burns, I've seen you with cuts, with accidents. Tell us about a typical case. So supposing a person has met an accident and come to you, how do you react? What are the stages or steps in which you treat that person?
Okay, so see, as a plastic surgeon, I deal with trauma of practically every part of the body. But I think closest would be a facial fracture, or you have open fractures of the extremities. So when such patients come to me, first of course they have to be stabilized, because if they have a facial fracture, then they also have a difficulty in breathing, they would have difficulty in swallowing. So all that has to be taken care of. Once the patient is stabilized, then we usually go in for certain investigations. So it could be a CT scan, it could be an MRI, depending on what are the fractures that the patient has sustained. Then we decide what is the best possible method of reducing those fractures. And being a plastic surgeon, we always have to have invisible, or the scars basically should not be seen. So the access routes have to be decided, so that there is no scar on the patient's face. So usually if it's a fracture under the eye, we will try to go from inside the eye. That's known as a transconjunctival approach. So there's no scar on the face of the person. If it's a jaw fracture, then we go from inside the mouth.
Okay.
And then we have implants, just like you have in any other fracture. We put those small mini plates and kind of, it's like a jigsaw puzzle that you need to put together, because it has to be form and function. So you have to create the form, and also there has to be function, because it's the patient has to eat, he has to speak for the rest of his life. So that is taken care of. Again, in extremity trauma, if there is a fracture with an associated soft tissue injury, then that also takes precedence, because unless that is taken care of, unless that is addressed, the fracture will not heal. So
you know what, in my own family, I remember a discussion, a dialogue when there was a baby being born, and you're not a gynecologist. We needed a gynecologist to deliver the baby, but the patient was keen. Why don't we call in Anjali Saple to stitch me up? I can see the kind of confidence that younger girls have in your stitch, because it's the neatness with which you finish. Have you ever assisted a gynecologist or a heart surgeon so that the beautiful part of the stitching is done by Anjali, and lo and behold, you look so beautiful, there's no scar left.
Yeah, there are certain cases where the patient has asked for it, that I want to be stitched by plastic surgeon, and then I do go in. The fact is that when we do the stitching, I always use a magnifying loupe.
Okay.
So that is a 4 or 5 times magnified appearance of the skin edges. So that helps me to give a good approximation, and that finally translates into a good scar.
Okay. So Anjali, if you have to rate yourself as a good, a scar specialist or person, how would you rate yourself in a scale of 1 to 10?
Ah, that's a difficult question.
Where is Anjali? Where is Anjali on 1 to 10?
No, that I don't think it's not fair that I should rate myself. I think that.
No, but you know that you're the champion. You are the champion, absolutely.
I would probably give myself an 8 or 9, definitely,
8 or
because
9.
that's the kind of effort that goes into that.
Very true.
It's a lot of, in fact, that when I'm stitching up a person's face or any injury, the kind of concentration that I need, at the end of it, I really require some time off, so that I can get off
that's true.
that zone.
That is true. Tell me about this concept, this Korean skincare, glass Korean skincare. What is this all about?
It's become a big rage nowadays, right? So there are a lot of Korean products which have become a rage. But what people don't understand is that Korean skin is different from Indian skin.
Correct.
That is number one. Number two, climate is different. Korea is a cold climate, whereas India, we have humidity and it's a tropical country. So those products do not work for Indian skin.
Oh, they're rice-based products,
yes,
is it?
Yes, they are rice-based. They have a lot more, what should I say, moisturizing properties. So they are more oil-based. Whereas our moisturizers, what works for Indian skin is it should be more water-based.
Okay.
So that is another thing. And even their skin color, their skin quality is
totally different.
Yeah, it's totally different from ours. So it should not be blindly followed. That's what I personally feel.
I want to come to a favorite topic. Anjali, why do we age?
Basically aging is a 3-dimensional issue. So it's what is visible is only the wrinkles on the skin, the sagging skin, the muscles that, the loss of muscle. But it always is a 3-dimensional thing. We not only lose bone density, we lose muscle, and there is a lot of flab that gets deposited under the skin. Plus, in addition to all the muscle action that we've been doing throughout our life, it gives those wrinkles. And gravity. So, everything just pulls down. In women, the menopause plays a very important role. So, we have a loss of estrogen, and that kind of, reduces the protective effect of estrogen. Estrogen is normally, it plumps up the collagen and keeps the skin looking younger. Once we lose that, the skin becomes dry.
The elasticity goes.
And that's what causes the aging.
And what do you think is the right age for us to get into plastic surgery or reconstructive surgery or skin surgery? What is the best age?
Skin care should start from as early as 20s, I would say. So that includes cleaning, toning, moisturizing, sunscreen. Okay. Now regarding the surgery, I would say it all depends on how comfortable you are in your skin. If you feel that no, I'm not looking good, then there is no right age for it. I have so many youngsters coming to me, probably because of staring at screens and all. They have a lot of hollowness around the eyes. Girls who are as young as 25.
Oh my God.
So they come for a little bit of fat grafting around the eyes, and that gives them a more youthful look. I have ladies at 70 coming for a facelift.
Yes.
So if the person is, what should I say, healthy and in reasonable good health, has a good fitness routine, there is no really, it all depends on personal preference, I would say.
You know, this fad of Ozempic now, everybody, they use it as an easy way to lose weight.
Lose
And there are
weight.
many celebrities who are endorsing this product. They're looking terrible, some of them.
Yes.
But what is Ozempic, and how does it help the body to lose? And what is the disaster that happens in Ozempic?
So Ozempic is basically semaglutide. Okay, it started as an anti-diabetic drug, but they noticed that the side effect of that is weight loss.
Yeah.
It basically increases the satiety. So the person feels full even after having a very small meal. It decreases the gastric emptying. So because of all this, even probably after 12 to 18 hours of eating a meal, the person does not feel hungry. So automatically there is weight loss. But a major side effect of this is that there is also nutrition loss. So it's almost like a medical form of bariatric surgery. So the person has to take nutritional supplements. And you must have heard of the Ozempic face.
Correct.
If you see
Karan Johar.
Karan
looks,
Johar,
yes, poor
yes.
chap.
So, there is a loss of muscle, there is loss of bone, the skin starts sagging, and you need to have certain other things like, fillers to give that kind of youthful look back. So, that is one thing. Second aspect is that as you take this semaglutide or Ozempic, the body starts getting resistant to it. So when
Correct.
you start with a smaller dose, later on that dose doesn't work for
So
you.
it goes
So
on
you have to
increasing.
go on increasing.
Oh my God.
Ozempic is not available in India.
Correct.
Here we have Munjaro, but that is also on the same lines. A lot of nausea, vomiting, those kind of side effects are also there.
Now, if you have to advise a patient who is obese, sometime back it was bariatric, and I know how safe and scientific it is.
Yes.
But supposing you had a thing between invasive and non-invasive surgery, a choice, would you suggest an obese patient to go for Ozempic or for the bariatric surgery?
So definitely medical treatment is better than going in for surgery. But I would leave this to the physicians.
Okay.
Because I don't prescribe Ozempic myself. I always have an endocrinologist with me. So if there is an obese patient who has a BMI of say above 30, because many of them come to me for liposuction.
Yes.
So in those cases, I don't really take a call on that. It's safer that they go to an endocrinologist, and then finally it is his call whether he wants to put the patient on drugs or he wants to advise surgery.
When we talk about liposuction, it's something that happens in a certain area of the body. You remove the fat.
Yes, yes.
But this is not, it's a temporary thing, isn't it, Anjali? Does it come back again, the fat?
If you don't maintain your lifestyle. Because when we remove the fat, that's a permanent removal of fat, of fat cells. There is a very constant number of fat cells in the body. So when we remove fat cells, those are permanently removed. But the existing fat cells may increase in size.
Correct.
If you do not maintain your diet, if you do not maintain your lifestyle. So in those cases, then those fat cells will increase in size, and then the effects would be nullified to a certain extent.
But I mean, how safe is it to do it once or twice if some people have a problem?
It is safe.
It is safe.
Yeah, it is safe. You have to basically restrict yourself to not removing too much of fat at one go. So if there are multiple body areas to be treated, then usually we divide it and do it over stages.
Because
So
I remember a Telugu actress, she died of
Yes.
this. They overdid it, and
And see, that brings me to the point of quackery, because there are a lot of self-proclaimed cosmetic and plastic surgeons, and when they don't have the basis, the basic foundation, then it's like you're really dealing with danger, right? So
I've been reading of late that the typical metformin that you take for diabetes is also helping a lot of people anti-aging. So people take it irrespective of the fact that they're not diabetic, many doctors in fact, and somehow they're combining lifestyle with metformin is making them look young. What do you have to say to this?
So this is again something that I get my endocrinologist into the picture. So let him decide if he feels that this person would benefit with the medical treatment, then because I don't get into that.
And there's this guy, this Brian Johnson. He is
Yes.
viral. He's
Oh,
all
yeah.
over. He's all over the internet.
Yeah.
He's an entrepreneur, and I think he was a venture capitalist who made so much of money. He didn't have to work after that, so he started working on himself.
Yes.
And he's challenged that he's going to reverse his age, and he's going to go back and live to at least 150 years. It sounds very nice. It's like an experiment, and if it is really fruitful, maybe it's going to change the way we look at science of the body and sculpting of the body. What do you have to say about this experiment of Brian?
So, see, a lot of regenerative medical technologies are coming in, and like for example, we have. So I think he injects his son's blood into himself.
Every part of his body is controlled. It's controlled by computers.
A lot of gadgets and all that. So a lot of research is going into this, and that's probably the next frontier, regenerative medicine. In fact, if you've heard of PRP and PRF, and so here what we do is we take the person's blood and we convert it into that platelet, rich plasma, and those are supposed to have stem cells to help in rejuvenation. So you must have heard of vampire facial. So basically that is just that PRP being injected into the face. The same PRP for hair growth. These are all types of the regenerative medicine that Johnson is trying. Then there is also something known as nanofat. So again, our own fat cells or adipose cells are known to be storehouses of stem cells. So we are processing these and trying to inject it back into the patient's body to help to reverse aging to a certain extent. So so this kind of works like a autologous filler. We have fillers which are available in the market, but fat, it's also known as liquid gold.
Correct. So they're harvesting that now.
Yes, so we are harvesting that and using it. So I guess maybe few decades down the line, we may just be successful in reversing aging.
Really, I often think about male boobs versus female boobs, and it's a big problem because you deal with both. Men who have fatty boobs and women who have a problem with reconstruction because of cancers and other things. Sometime back they would just cut the breast and let it be, but today you have an opportunity to save your breast. So tell us more about breast reconstruction.
So breast reconstruction can be done either with the help of implants or with the person's own tissues. So a lot of options are available. We can use the lower tissue in the abdomen, or we can use the buttocks or the back. And I would say that this is a need of the hour. When the surgery is happening for the malignancy, the plastic surgeon should be involved. And if possible, the reconstruction should be done on table immediately, if the cancer and the stage allows. Because that gives that completeness to the lady. She doesn't come out of the OT feeling incomplete. And when we have the options, then I think a person should exercise those. Now we also have something known as BCS, or breast conservation surgery, where if the person is diagnosed early, then we can just remove the lump, and that much can be reconstructed. So gone are those days where the woman needs to live with one breast off. Regarding male boobs, that is a very, very pressing issue nowadays, because I find so many youngsters and so many teenagers coming, and they are their body image, their confidence, everything is so low because of this. They don't go to the gym because they can't wear those t-shirts. They don't go swimming. They're always conscious, and they try to keep themselves to themselves. But the moment they are operated upon and this is removed, you should see their new attire and their new confidence. It's
but is male boobs a common phenomenon normally?
It's off late it is becoming common.
Is it a lifestyle?
It is lifestyle. I think it is because of lifestyle. the kind of fast food that this generation is addicted to, lack of exercise. Because when we were growing, we would be running most of the time, and now it's more of sedentary, and can't even blame them because there's so much of pressure on them.
That's true.
Yeah.
I was reading about HIFU, high intensity focus ultrasound.
Yes.
I think that's a new therapy, a new kind of a treatment. How do you use it?
So it's HIFU. It is basically a machine that helps to tighten the muscles and the collagen in the skin. So it's not a single treatment. The person needs to come for multiple sittings. But yes, definitely after probably 5 or 6 sittings, there is visible tightness of the skin. It's not permanent. They would need to come in again for probably a few more sittings.
Some time back, all of us used to go to beauticians for facials, but now the trend has changed. We come to doctors because we feel safer.
Yes.
And there are a lot of skin tightening facials, hydra facials, and melasma treatments. Tell me more about this, the face. Now it's almost like going to a parlor when you go to a cosmetologist.
It's almost like medi spas and all. So basically, in hydra facials, what we do is, it's also, along with the peels. So these are basically alpha or beta hydroxy acids. So during the facial, the outer layer of the skin, that is the dead epidermal layer, is kind of removed, and then we kind of infuse it with multiple actives, you can say. So that kind of gives a glow to the skin, and it's very safe because you're not using very harsh chemicals, and it is under supervision of a medical professional. So
Anjali, so normally now in a hospital, you get all kind of patients and you're busy all the time. So what is the profile? How many patients come to you with a medical condition? How many of you come to you for a beauty facelift or one of those cosmetic surgery?
Okay.
What is the proportion?
I would say in today's day and age, it would be 50-50.
Oh my God, 50 people?
Earlier it was, people would not come out for these kind of surgeries. Probably they would not come in Vizag and they would go outside Vizag. I have no clue. Or then whether it is just that they have more confidence now.
Yeah.
But yes, and I am sure the trend will start reversing. Probably it will be 70-30 a couple of years down the line.
What are the post-operative, what are the post-operative sessions like when someone has a rhinoplasty or a cosmetology?
A lot of hand holding, yes, because see, they've undergone a surgery, and there are a lot of questions. So most of them have my personal number. So if they have any kind of doubts, they are always free to WhatsApp. And usually I'm always giving them the advice on, even before they are discharged, or most of the times it's a daycare procedure. Before they go home, everything is explained to them. So each surgery has their own post-operative protocol. Like if you're having a liposuction or a tummy tuck, then you need to wear pressure garments.
Correct.
If you're having a rhinoplasty, then you would have the splint, should not blow your nose, and so on and so forth. So everything is properly explained to them. We see to it that they've understood the post-operative advice, and usually the first week we call them at least twice to see how they are healing. Then usually it's depending on how the healing process is. Then so over at least for a month, they really need to be followed up well, to see that there are no post-operative complications.
But how often do you have post-operative complications?
Not very, but because a person who says he does not have complications, that means he's not really
something wrong.
Yes, operating enough. But but then see, the thing is that you need to know how to deal with them.
Yes, that's true. Tell me now, with this beauty industry becoming such a big deal, men and women equally want to look good.
Yes.
So what is the percentage of the boys who come to you? I understand women coming.
Yes.
It's a woman thing, but a lot of boys are also very conscious.
Also coming, yes.
So how many boys come to you, and are they confident when they come to you?
Yes, they are. I would say 70-30 still. It's more of women coming. Boys come for rhinoplasties, gynecomastias, and liposuctions predominantly. These are the main indications.
And what do you think is the future of the industry?
I think it's just going to, there's going to be, boom only. It's already on the upswing and it's just going to go on and on. And as long as people are obsessed with vanity, it's just going to go on. And I think, because we have a lot of technology also coming in now. So surgery combined with this technology is going to give much more longer lasting results, I would say.
Wonderful. And what is your advice for aspiring surgeons? So there are a lot of young people who watch the podcast and they might want to be doctors, but then to become a surgeon, normally people would think surgery is something else, but you are doing something totally different. And this is the trend, it's the viral type of surgery. What is your advice to, surgeons, budding surgeons?
I would just say that, be passionate about what you do. Don't really be ethical, because, this profession or this line, especially aesthetic, there is a very high chance that you can become unethical. There's a very fine line. So if you stick to your ethics, then I think everything else will follow.
You are also a yoga exponent and dancer. So I've seen some videos of you doing both.
Yes.
How does this help you? You're in a field where you talk about lifestyle, you talk about health, and you actually practice it. You go cycling. I see you cycling around. Anjali, how does this help you balance? Does it help you balance yourself, or to also be able to advise somebody to do this?
Yes, because you need to practice what you preach. So I think yoga has truly helped me, because, with my kind of surgery, where earlier I used to develop a lot of neck pains while doing those microscope surgeries, but following yoga, everything has just vanished.
Yeah.
And the meditation and the pranayam that comes with it, it grounds you totally. I would strongly propose that everybody follow yoga. I think we're having a nice month-long yoga
and a Prime Minister is going to be in our city too.
In our city. So I think all youngsters should take it up. And dance is, of course, it's just...
it's beautiful.
It's just beautiful.
It's just the soul. Anjali, have you ever tried any of your surgery on yourself?
I wish, but no, not really.
You've not tried anything that you profess on yourself?
Yeah, okay. You mean I have got it done?
Yes.
Yeah, so probably I got my ear piercing done. And other than that, no, not really. I haven't really. See, again, it's the thing of you wanting to get it done, right? If somebody is comfortable in their own skin, you don't really need it. And thankfully, so far, I am comfortable in my skin.
You're beautiful. You are beautiful.
Thank you. I don't want to go in for anything at the moment.
I have a list of myths.
Okay.
I just wanted your opinion. Cosmetic surgery is only for the rich and the famous.
Myth. It isn't.
And
it's for everybody, and every procedure can be made tailor-made and affordable for everybody. It's not just for rich and famous.
But how expensive is it? A basic cosmetic surgery.
No, it's difficult to address this question, because it all depends. A lot of factors. What kind of surgery is required, how many areas need to be treated, and what kind of expectations are there from the patient. So if these cosmetic surgeries are broken down, small surgeries can be done at a very affordable cost.
It can be.
Yes.
Results when you do cosmetic surgery are instant and permanent.
No. Again, that's a myth, because results take time and you need to have patience. For example, if you're doing a liposuction, for the skin to contract over that sucked area takes anywhere from
years.
6 weeks to 3 months.
Months.
And you need to wear those pressure garments. You need to go in for your lymphatic massages. You need to maintain your lifestyle and your exercise and your dietary routine. It's liposuction is not a free pass to go and eat anything and everything
after that. Yes.
So that basic responsibility has to be taken by the person.
Cosmetic surgery is the same as plastic surgery.
No, plastic surgery is the big umbrella where we have reconstructive surgery, like, for accidents, trauma, cancer, and cosmetic surgery is to kind of beautify what is already present.
Okay, so there is a difference, but both are the same in a way.
In a way, yes.
It is easy to look natural after surgery.
Yes, it is. This is not a myth. It is, provided done by the right person.
Correct, correct. It depends on the hands that work on you.
Yes. So you choose your person. You choose a qualified professional to go.
Cosmetic surgery can solve all your problems.
No, it's a myth.
It's a myth. Everyone will notice that you've had cosmetic surgery.
Again, that's a myth. Because if you go to a qualified professional,
it will be done well.
It will be done well, and it's always, to keep the change subtle.
Age is just a number. We hear this so often. Is it a myth or is it true?
I would say it is true, because you see people who are really, who I would call old, but they don't feel old. They are doing everything from marathons to cycling to swimming. And there are youngsters who are, just closeted up because they are not confident.
That's true. Recovery is always the same, whether you're doing regular surgery or plastic surgery, and health, everything remains the same after you recover.
So no, I didn't understand this question.
Recovery is always the same when you do a plastic surgery. It's always the same in the sense, irrespective of which part of the body, you will recover in the same way.
No, that's not true. Because there are certain, like face heals up very fast as compared to, say, the back or the extremities. So these areas take a little longer time to heal. So it all has to be tailor-made depending on which area the person has undergone the surgery.
Somebody in Hindi said, "Aa bail mujhe maar." So he said, cosmetic surgery is dangerous. Don't invite trouble. What do you say?
No, that's a myth again. Cosmetic surgery, if done right, it can do wonders for yourself, for your body, for your confidence. And
very true.
Yeah.
Non-surgical options are always better.
No, again, that's a myth, because non-surgical options have their own indications. Surgery has its own indications. So, like, for example, you have a lady who's struggling with huge breasts and she's not able to do her day-to-day chores. Non-surgical will never work for her. She has to go in for breast reduction.
Correct. Can you share some success stories? Yeah, I mean, you must be having lots. Yeah. Somebody who's emotionally touched you, or a very dramatic thing that has happened.
Okay, there have been many, but one is very close to my heart, because kind of she's been my patient since she was a child, and she had a cleft of the lip, palate, nose, very, very severe cleft, and the parents, she was diagnosed in utero.
Okay.
So they came to me that should we abort the child, and I said no, because this is not a non-treatable condition. So she's been my patient since she was born. She's undergone multiple surgeries, and now she's a beautiful girl of 19.
Wow.
The last surgery that I did on her was her nose, and she constantly surprises me with her talent, with her confidence, and it's so humbling, Meenakshi, because she's a talented Kuchipudi dancer. She recently got the prize in some competition that they had in Pune. She's a trained Carnatic singer, and recently her mother messaged me that she stood first in her 10th class with, I think, some 97 or 98%.
Amazing.
So this is something, like, it's so humbling, and also it kind of it's also flattering that you've been
responsible for this, yes,
in the journey of this child who would probably have not seen the light of the day.
Very true, very true.
So I think this is, it's something, it really makes me feel honored to be a part of this profession.
Tell me, Anjali, how important is family support, and what is your family all about?
It's extremely, extremely important. I'm sure Any successful woman or man, for that matter, would say that. And I always had a very encouraging father and mother. And then after marriage, my husband, you know him very well,
Yes.
uh, my in-laws. So they've always been there for me whenever I needed them. And I think it really matters, the upbringing. My sister, who's always been beside, she's always encouraging me. Whatever I do, she's always there to encourage me. My brother, he's a source of inspiration. So I think, yes, family truly makes a difference.
Yes.
I have
And
two boys. who
yes, you have beautiful
dote
boys,
on me.
very smart boys.
Yes.
Yeah, it's lovely, Anjali. And as a working woman, you have rocked your cradles. You have taken care of your old parents as well as your in-laws. You've been a good wife. What is
I'm
the,
sure.
you
I
know,
hope Amit says that.
what do you think? In which role do you think you're the best, Anjali, personally?
Personally, okay. I would think as a mom, Meenakshi, because I think that is something that that has made me grow as a woman. It's always been something to, you know, give without expecting anything in return. So I think that is something that has probably been my best role.
And if I had to ask you for one word to describe yourself, you, Anjali, what would that word be?
Of it's a difficult question. I would say very hardworking.
Hardworking.
Yes.
It's such a pleasure, Anjali. I've been trying to get you to the seat for a long time. And you know, actually, you have the pulse on so many topics that can just, blow up the studio. If I keep talking to you, it'll go on for hours and hours. So today I decided to take only one aspect because I know you're an ocean of information. But I know you've left a lot of patience and come here to be with Meenamma. Have you been following my channel? What do you think of Meet Meenamma?
It's amazing. I see your different roles, and it's always very your chirpy nature. Amazing. It's really nice.
Thank you so much. And for all those who are watching, there's something powerful in being able to change the way you look. But what is more powerful is being able to change the way you feel. And that is what exactly doctors like Dr. Anjali do. By putting their hand on your shoulder and helping you to think that you are the best, they actually tell you that you can change your destiny. You can be the master of who you want to be. And when you start thinking like that, the world is your playground and nothing can stop you. Really grateful to have friends like Anjali Saple who have made the world of difference, not just to patients who are groping in the dark, but also to beautiful people who wanted to look better, feel better, and do better in life. Anjali, it is such an honor, and I would like to give you a small token. This is a cup of Meet Meenamma, and I hope that, like this cup, your cup of happiness will overflow. And
Thank you so much. Thank you.
I would like you to ask my audience if they like my work to subscribe to Meet Meenamma. You
Yes,
can say it.
I must tell all of you that please subscribe to Meenakshi's channel. I'm sure you will enjoy the journey just like I do.
Thank you so much. God bless you guys. And remember, don't forget to subscribe because when you subscribe, you help me grow. And I can get wonderful people like Anjali Saple on my show. Thank you. God bless you.